Hello and welcome to the Missing Link for the SLPs podcast. I am so glad you are here. Today's episode is part of the Medical SLP series where we talk to some amazing speech paths who work in a variety of medical settings, all the way from intensive care through to home care and everything else in between and beyond. You're going to hear some incredible medical SLP stories and lots of advice from these passionate medical SLPs. Welcome to Lauren. Happy to have you here. Names are so important, so I'm just really glad to have you here on the Missing Link for SLPs. Welcome to the podcast, Lauren.
Thank you. Thanks for having me.
So you're going to be a very popular episode because you are bringing together the pediatric world and the med SLP world. So just like a wonderful combination of two of the things our field has to offer. So tell us a little bit about why you became a speech pathologist, and then we're going to jump into a deep dive into your settings and all that you do as a pediatric SLP.
So it's a pretty uninteresting story. I started my college career as pre-vet. I have a lot of animals, so everyone was like, you should be a vet, you should be a vet. I didn't really know what to do, so I was like, I guess I'll be a vet. And I started that, and I hated it. Yeah, so I guess it was my sophomore year, like first semester of my sophomore year of undergrad. I went to my advisor and was like, I don't like this. So I literally just picked up the course catalog and was like, what do I think sounds kind of interesting and I can make an A in while I figure my life out. And they had intro to language, and I was like, it was intro to communication disorders. I had to also take intro to language, but it was the communication disorders. I was like, oh, that sounds like I can make an A in it. That's terrible to say. But that was the truth. And so I took that and I loved it. I loved it. And so I was like, yeah, I think I'm going to be a speech pathologist. And my whole family was like, what are you talking about? But I didn't realize this until later, until I got deeper into the coursework and stuff. But I always, in high school, I really always liked English and science, which was such an interest, an unusual mix, of interest. And as I got deeper into SLP world, I was like, oh my gosh, this is English and science. So It's perfect. So that's that. I graduated in communication disorders, my undergrad, and then I wound up at the university. So I'm from South Louisiana, from New Orleans. And so I ended up at the University of Memphis for grad school. I am very much a homebody and was pretty terrified to go, but I got accepted. It's a competitive program. So I got in, and then I was like, oh, it's so expensive. So they had this a mentorship or a traineeship. We had a professor having a grant, and they were taking 2 people to work on this mentorship, and you would get in-state tuition and a stipend and everything. So I was like, well, I'm gonna apply for this, and if I get it, then the universe is telling me that I need to go to Memphis. They're only taking 2 people, and I think I was secretly hoping I wouldn't get it because I was scared to move. But I got it, and so they called me, and I was like, oh God, I called my mom. I was like, I got the mentorship, and she was like, yay. So went to Memphis, and it was great. Yeah, it was. Yeah, so I just was I have to go. I can't not go. So I went, and now I'm a speech pathologist.
How long have you been a speech pathologist?
It'll be 8. I graduated 8 years ago in May. So this is my 8th year.
So now you're on the medical SLP series. You're going to tell us about your medical SLP work. Did you always want to be a medical SLP? Any interest in working with kids? in the setting?
Yeah. So I always thought I wanted to work with kids, which is what I do. I always kind of, entertained med school for a while. So I always definitely gravitated more towards the medical side. I like blood and guts, I guess. I was, like I said, I was always really interested in the science aspect, I think more so than the English. So when I was in grad school, I was really, really fortunate. Like I said, I went to the University of Memphis. I was fortunate to do a clinic rotation at St. Jude. And so that was great. And I loved it. And so I got a lot of good, medical experience there. But that program, I think, is really great because they require, everyone had to work in a hospital. Everyone had to, or do a clinic in a hospital. Everyone had to do a clinic in a school. So you really got to see everything that was out there. Mm-hmm. I don't know, I guess I just always kind of gravitated toward that. And I started my professional career in the schools, actually. But I always really liked those more medically complex kids. And I ended up at a school that has a high special ed population with like a lot of orthopedically impaired kids and more medically oriented kids. But then I ended up a little bit earlier going full time to the hospital because I couldn't get CF there. It's kind of tricky. There's not so many spots. So I got my med SLP position. I didn't love it as much as I thought I did. So I actually ended up leaving that and going back to the schools. But in the meanwhile, it worked out because I really found this like super love of feeding and swallowing disorders that I always was interested in. I liked it in adults, but a lot of grad schools you just don't get that much experience. So it was lucky that I went because that's when I kind of was like, I really want to focus on this. So another part of the reason I went back to the schools was so I could like devote time to, studying and getting some advanced trainings and stuff. And so now it's great because I'm able to PRN and I only take feeding kids. I get a lot of babies coming out the NICU. And then I work for our state early intervention program. And the same thing, I only take feeding kids. So it's like the best of both worlds. I get this like nice school schedule and I'm actually on the AAC team. So I see all severe, profound, non-speaking children. A lot of those do have, co-occurring medical diagnoses. So it's great.
So interesting because a lot of people will come to fresh SLP and they'll say, I want the school setting, I want the school calendar, I want to work with kids, but I like the medical side of things. And it seems like you've been able to pull both together.
Yes. It was not easy. So I don't want to give this false impression that like, oh yeah, you just do that. Because it's taken me 8 years to make it happen. But yeah, that really is almost exactly what I've been able to do is really pull in the things that I love and kind of make my own little niche market. And it's great. I love it. I'm passionate about it. I'm not, grumpy I do work full time in the school system and then see kids afterwards. So, a lot of people are like, oh my gosh, like, how do you function? Are you not tired? But I love it so much. Like, no, I'm not tired. I'm stoked to go see these kids. And then it's great because I'm kind of, becoming where I'll get a lot of like personal referrals. Like people like, oh, you need to go see this girl. So it's nice I get kind of the most complicated things, which is what I really like. So it's great.
Mm-hmm. Yeah, I like complicated too.
Yeah.
So tell us how your typical day works out. When do you start? When do you end? Do you get a lunch break?
I do lunch. Yes, I do eat lunch. So like I said, I work, my main job is in the public school system. So I get to work at 7:10. Our school day starts at 7:20. So I have, depending on the day, the way I like to, okay, so we have a lot of control over our schedule in the school system, which is, for those who are considering or coming out of school, that is a big perk of the school system. So I like to front load my week. So most of my Mondays and Tuesdays are the heaviest. I travel to 9 different schools. So yeah.
Is that typical?
Not that many. So like I said, I'm on our AAC team, which is the severe and profound non-speaking students. A lot of kids on devices, but also just your emerging language, like lower level communicators. So the way our public school system is set up, we have, not every school has every class. So a lot of these kids, they only go to certain schools that have like severe classes for, their disability. So there's not enough need at one school for me to be there full time. If that makes sense. So those of us who are on the AAC team, we travel, but for our like more traditional SLPs, they are at 1 or 2 schools.
Okay. That was the question. So your day starts at 7:10 in the morning.
Yep. And so I'm at school, I see kids, I go into classrooms, I see kids until, my day ends at 2:15. So I usually see kids until 12:30 or 1. And then I have like paperwork and everything. I do eat lunch. I think that's really important. When you're given a lunch, you should take it.
Yes.
Don't work for free.
Words of wisdom. Take that lunch break.
Yes, take your lunch break. That is included. I tell my grad students all the time, do not work for free. You are a professional and you are entitled to be compensated for when you're working. So then I leave at 2:15. I leave school and I go see on Mondays and Tuesdays is when, right now, I have my early steps kids. So that's our early intervention program. So I'll go either to their daycare or their house, wherever, the child is at. And I see them, I have 2 patients. So usually like 2:30 to 3:30, and then like 3:45 to 4:45. Part of the perk of that job is that I choose the kids I take. So I only take kids that are like geographically convenient for me, just because I work everywhere. So then I usually go to the gym. So I get home at like 6 or 6:30. And then on Wednesdays, I have my same school schedule. And then that's kind of my like catch all day. If I have any new evaluations at the hospital, that's when I'll schedule them. So if I have a baby to go see there, I'll go over to the clinic. Well, it's an outpatient clinic, but it's affiliated with the hospital. So then I'll go there. And then Thursdays is when I have like my regular standing patients that I see at the hospital. So after school, I go see them and see if there's anyone upcoming that I need to schedule for the next week. And then on Fridays, I only work at school. I don't do anything extra.
You are busy.
I am a busy bee. Yeah. I'm also getting married in a month. So. Yeah.
Congratulations.
Thank you. Yes.
Congratulations.
Thank
Lots
you.
on your plate.
Yeah.
But you've got a lot of passions, a lot of loves, a lot of drive.
Yeah. I get really bored if I sit at home. With the schools, we have a lot of breaks, which is another perk of the schools. So sometimes I'm like, oh man, I'm like sit at my house for like a week, and I like 2 hours in, I'm like, well, I'm bored, so I need to go do something. So it's great. Like I said, I like that I have enough control over my like medical people that if I feel like I'm getting like, oh, I'm too busy, or I'm getting like burnt out on this, I can like take a step back.
I was just going to ask, what do you do if you do start getting burned out? Any words of advice there?
So when I was full-time working at the hospital, I did get really burned out. That was a really hard schedule for me. Just that many kids back to back to back was pretty exhausting. So I changed settings. So that is an option though. I think a lot of, especially newer grads, feel like, oh, I have to work at a job for like X amount of years. And that's not true. If you're waking up unhappy to go to work, you need to explore a different setting. And there's no shame in that. You're not a bad person. You're not a bad therapist. That you're just a human. But so for what I'm at now, if I feel like I'm getting burned out, I like, as far as my kids I see regularly, I wouldn't leave them. But that's when I say, oh, I really can't take a new eval right now, or I can't pick up a new baby right now. Although typically what happens is they'll call me with a baby that really needs me. And I can't am I going to be like, oh, well, sorry, I guess your kid just won't eat? Of course not. So I haven't gotten to the point with this setup where I felt burnt out, I think, because it works out for me. But I do think it's good to plan ahead for what's going to happen when you feel like you need a break. Vacation, you're given vacation days if you're working like full time somewhere, and take them.
So you've got a variety of different things that you do. What is one of the favorite things that you do working in the school system with those kiddos?
Oh man.
Same question for the hospital.
Okay. So in the schools, so just as a caveat, right now in our school system, we do not address feeding or dysphagia. Just like that's relevant to say. We're actually working on building a team. But so in the schools, that is not something that I do at this time. I focus really on functional communication. And when you have a kid, especially a kid that is either like severely autistic or low cognition, that they finally like get it. Especially those kids, my kids that have more impacted autism, that have a lot of maybe behaviors that they're using instead of functional communication. Our kids that are screaming and hitting and biting. The day that kid finally picks their device up and says, "I need a break," it's the best, and everyone is so happy. And so just that's probably my favorite. I co-treat a lot with our OT. With COVID, obviously we're not able to do as much fun stuff as we used to, but I'm hoping it'll come back. So I love to we'll like plant seeds in the spring. We make like trail mix for my kids who are able to eat, because I do have a lot of kids on G-tubes. But I think my experience with that, I'm really good at. For our kids who aren't going to be able to eat, they can still participate, and like I can think of something else that they can do that. So I love co-treating. I love like doing hands-on, like really functional things. I love making a Mother's Day gift, or going, what we don't do right now because COVID, but like we'll go to the zoo, we'll go bowling, we'll do like these community-based activities. So I love that as far as the school. And then my medical stuff, I love the babies. I love getting little NICU babies or babies coming out the NICU. I love, again, when I can, it's like the best when a parent or someone comes in and they're like really struggling and I can be like, hey, do this. And then they come back, they're like, oh my gosh, like he's eating, it's working. And, they're so happy. So that,
was it scary starting in the NICU with those NICU babies, or when they were first coming out of the NICU? How did you build your confidence in that?
I think so. I did a lot of training, and like CEU courses. This is something I think is really important, not just training with the person who currently works in your hospital. And that's right. Like, and I'm not like hating on the person who works in anyone's hospital. I'm sure like everyone has very good, competent people, but I think it is so important to go like directly to the source and get, different, not necessarily opinions, but that's something important too. Don't have opinions, use science. So, I've done Karen Mitchell, her NICU course is so good. It's NICU and Transition Home. It's offered through CHOW. I think it's such a good like intro course. So if that's not something that you're familiar with, I definitely recommend her. I've done Erin Ross's course, Sophie. I'm Sophie certified.
What is Sophie for those who don't know?
Supporting oral feeding in fragile infants. So it is a feeding course designed for babies that are in the NICU and that are coming home from the NICU. So, sick babies. That is a really good one. I've done SOS too, which is Kay Toomey's feeding course. That though that's not for infants. So we'll talk about that later. But as far as I got a lot of training from the experts and the professionals. So I felt like I wasn't scared because I knew what I was doing. And I think that's so important. Like just prepare yourself. And so I really haven't had an experience where I've been like, I'm clueless, and I think you do know what you're doing. If you do your homework and you do your training, and sometimes you need to kind of like take a step back and take a breath and be like, okay, I'm a really smart, competent person. I have my master's degree. I've done this training, and then you know.
What words of advice do you have for the new or fresh SLP who's in her clinical fellow and she wants to move into a career like you have, where it's in the medical setting working with pediatrics? So you're going to take your courses. How does he or she get started in the medical setting and started on the path like you've had?
Okay. So this obviously might vary from different regions of the country, but my best advice would be take as many CEU courses as you can. And again, if you can go to the trainings from the people, if you can go to Catherine Shaker or Erin Ross or Kay Toomey, go to their trainings and then get into the hospital system in any way that you can. So if the first job that's available is, an outpatient, kind of your more traditional articulation and language setting, take that. Because the hardest thing that I've experienced, at least, is getting into the system.
Right. So
you need to get in, even if that's not your dream position. Because also how most of these places work is they'll hire from within. So if you're trying to come, say from a school system or straight from grad school, and you want to go work in the NICU or work in acute or something like really specialized, you better be amazing. And if you're a new grad, you are amazing. You probably are amazing, but you don't have that experience to make you as amazing on your resume. So, but if you're already there and you're working, then you have this opportunity to, show, hey, I have interest in feeding. And maybe you take one feeding kid, or you say, hey, I have some time at lunch. If you're in a physical hospital, like, hey, can I go with the inpatient, the acute therapist? So getting in is going to be your hardest part. And then I think, like I said, too, just take every opportunity, because kind of how I got started was I did a little bit of feeding in grad school. I loved it, but then when I came back, I kind of forgot about it. And I started with like one or two feeding kids that our lead SLP, no one else really had an interest in it, was really comfortable with it. And so I was like, yeah, I want to do that. And so the first few, looking back, I didn't know what I was doing. And that's a little embarrassing, but whatever, it happened. But so that just start with one kid and find a really good mentor, find a person that is passionate about it and will help you and will be your biggest cheerleader and tell you what courses to take.
And you can you can look to your state association, speech and hearing association for mentors. You can look to dysphagia clubs in your area or in your state for mentors. You can possibly look to ASHA for mentors.
Yeah.
Correct?
Yeah.
Any other areas of mentors or just other local speech paths who have the interest and ask them?
mentor a lot of people. And usually how it works is, we'll get a new hire, say at the hospital, and I say, oh, hey, like I introduce myself when I come, and I'm like, I'm Lauren, I do the feeding kids. And if they have an interest, then I help them out. We also, another thing that a lot of people I think overlook is OTs. So we share a lot aspect of the feeding. Not so much dysphagia. That really should be speech unless you're in California. But so don't discount your OTs. There's some really, really great OTs in the same way. If any OTs happen to be listening, don't discount your SLPs. So that I collaborate a lot with our OTs. I'm actually mentoring two right now that really want to get into it. And the same thing, they're like, I don't know what to start. So I'm like, take this course,
And have those conversations. I'm an assistant professor 4 days a week, and I keep my clinic days on Friday because I just love my clinic work, and I work with babies as well. And we had a little kiddo come in once upon a time, and the OT, she was newer out of school, and she said, oh, we just got this referral, and what do you do? What areas do you cover? And then we had this conversation about here's how we work together and collaborate and, pull from here and then from the mouth down. So yeah, definitely. Who else is on your team that you work with? You have OT. Do you work with anybody else closely?
So unfortunately, like I said, we're in an outpatient that's not like in close physical proximity to the hospital. So a lot of it is via like email, which is not my preferred format, but we do what we do. We have physical therapy is in our department. So our clinic is PTOT speech. So I work with them a lot. Also your physical therapist, like if you don't have good core support and good like seating, you're not eating well. So don't count them out either. Then obviously your GI doctor, your ENT, your child's pediatrician should be on this team. Nutrition for sure. A lot of these kids, especially once they start getting older, it gets really more complicated. When you have babies with some type of tube feeding system, that's when you really need to have nutrition on board. Because I have a lot of training in nutrition, but I am not a nutritionist, so that is not something that I would never be qualified to recommend like calories or whatever. But yeah, so all of those guys or ladies, people should be on your team.
All right. Words of wisdom for the new speech pathologist.
Oh gosh, I think my first thing is that be confident in yourself. You've gone to graduate school. You have a master's degree. You're a smart, capable person. So I think a lot of people come out really scared, and it's good to know your limitations and know what you need more help in, but also know that things. Okay. So that's kind of my first word of wisdom. Just know your own worth and your own abilities. Then with that, recognize where you need further mentoring and don't be afraid to ask for help. I get a lot of grad students or people I mentor, oh, you know everything, which I don't know everything. And the things that I do know, I didn't know because of magic. I know because someone else taught me. So seek out the help, and seek out as much as you can. These Facebook groups are great. People post on, Facebook groups like little CEUs, and sometimes they're cheap, $40 CEU on cleft palate. Take that. Do all those little things. And I think, take as much training and courses as you can. I always say for me personally, I'm not going to settle for mediocrity. I think part of what I really like is that I specialize in a really, really small area because I want to be really, really good at that area. I don't really like knowing a little about a lot of things. I want to really, this is what I do. And then I build my network of other people that are really, really good at something else. So when a parent comes to me and is like, oh, my kid stutters, for example. Well, yeah, I know about stuttering. I am licensed. I could treat that, but I'd rather say, hey, but you know what? I have a girl or a man, usually it's a girl, who is great. So, build your team of people that have your interests, but also people that have other interests so that you always know either what to do or who to send that child to.
Interesting fact, a lot of voice referrals that go to private practice voice speech pathologists, their referrals come from voice or are non, how do I want to say this? Just from of a more generalist SLP from the outpatient setting.
Yeah.
So they're referring on to somebody who is specialized in that area.
Right.
And that's good. That's great.
Right. I think our scope is huge, especially in this feeding world. This needs to be its own profession. because we have so many things. And even if you are the best, smartest SLP on the earth, like no human, I think, can possibly know everything about everything that is in our scope. That's just, I don't know that anyone's brain can hold that much information. So, I think pick the things that you love and be really, really good at that. And then know who's really good at the things you don't love so much.
Do you have a story you can share with us that was just more challenging for you in your setting?
Okay, yeah, I got one. So I saw this little boy. He came to me. He was 3 years when he came to me. And he had a really complex medical history. He had a brain tumor, posterior fossa tumor that had resected, like a partial resection. I think he had an astrocytoma, but don't quote me on that. But I know it was posterior fossa tumor. And so this was, I guess, about when he was a year old was when the tumor resection happened. But he subsequently had a trach, had a G-tube. He ate nothing by mouth, like just very, very aversive, had just like a really complicated thing. And their home situation was pretty complicated. A lot of guilt and blame put on the mom. It was not her fault. Like, she was a great mom. She still is a great mom. And so when he came to me, I mean, this was the most scared of food child I've ever encountered. This was pretty new when I had just done, actually, I started with him before I had done my SOS training, which thank God I took that course because it really helped me with him. The first time we ever saw him for the evaluation, the mom pulls out this little like drinkable yogurt smoothie thing, like a Danimals or whatever. The child literally screamed and ran out the room. And he was a darker skinned child. He turned white, screamed and ran out the room, like just scared to death. So therapy with him was like a really, really slow, really slow going. So he's one that is the type of child that I think can really make you question your competence because the progress is so slow. That like he was one that for sometimes I'd be like, man, like, do I need to send this kid to someone else? Like, I'm not good at this. But then, one day we had these little like graham cracker grips, like the teeny little graham cracker, like circles almost. And he tasted one, put it to his tongue and he didn't love it. He kind of made a face and was like, ooh, shook his face. I can't see. But previously, if he got a smell of food, if he got anything, like he would shut down. And this time he had this big sensory response, but then he was able to keep going in the session. It was huge, and his mom cried, and it was I cried, we all cried. It was great. But so, that I think is kind of, sometimes you'll get kids that it's easy and you'll feel like a rock star. I'm so good at my job. And then you get these harder cases that go, you have to stay the course. And he was one that really taught me, like, stay the course, do the program. But again, it was helpful because I did the SOS program and they have an advanced mentorship program, which I did as well. So, again, like I had that training and knowledge to know, like, you're doing the right thing. You're doing it right. Like, stay the course, which even knowing that, I still was like, it's not working. But it did eventually work.
Of course, in the cases like that, I had one little kiddo where we get him ready to eat, and even the presence of food would cause him to vomit. And so we would do flybys with him. We would take whatever it was we were doing. And he couldn't even tolerate on his tray from EssiPlay.
Yeah.
And we would just do a flyby and, eventually. And it's just stories like that they're good to hear from each other, because then we know that, not everything is like, oh, a quick fix and, oh, look how wonderful I am. But that taking these courses, learning from one another, and sometimes realizing that the work we do does take a long time.
Yeah, like a really long time. And what I had to remind myself with this little guy, because over like I said, by the time he was probably 4 or 5, by the time he started like entertaining eating things, he didn't learn to not eat in a day. So he's not going to learn to eat in a day. I just thought, I also had an instance where, like I said, I'm mentoring some OTs who are working like in feeding. And one of our OTs, she also just took the SOS course, and she got this little guy, really tough kid. I was saying, like 5 years old, super ex-preemie, like 28-weeker or something, G-tube fed, completely, super aversive to food. And she had her first session with him, and she was like, called me up. I was like, Lauren, it was terrible. Oh my gosh, it was awful. So that was when, because I had kind of helped her, like, okay, I want you to try these things, and they didn't work. And she was so upset. So I recommended, I said, okay, let's back up even further. This is too hard for him. Take, a whole orange with the skin, everything on, and try to roll the ball back and forth. This child also has some cognitive deficits. And the next week came and she texted me and she was like, oh my gosh, it worked. It was great. He eventually held it up to his mouth. And so that was just it was such a little moment, but that was so great because it gave her confidence that like she can do it. Made me feel good that I also, know what I'm doing. So yeah, just, like I always try to think about like, if what I'm doing isn't working, make the task easier. And I think if you keep that mindset, like if the child isn't doing what you want, they're missing a skill and the task is too hard. So that really helps me just know, like, keep myself on track instead of like panicking and be like, oh gosh, it's not working. Be like, oh, it's too hard. Make it easier.
Yeah. That's scaffolding. You add or you take away. Right.
And so
do you have a story you can share with us where you're like, this is what I do, why I do?
Oh gosh. Well, yeah. So I recently had a baby. I had two actually similar babies. Baby was like 28, 26 week, a little preemie. Discharged with an NG. Was doing well, like medically, just couldn't really get it together for eating. Wanted to eat. This is all, report coming to me from the hospital. Wanted to eat, just couldn't quite get that, suck, swallow, breathe coordinated, and just really wasn't doing well. And it was simple. I changed her bottle. I just gave her a slower flow nipple. And the parents, because we were talking about G-tube, the parents didn't want the G-tube, but we talked about how NG is not meant to be long term and this whole thing. And they came back the next week and they were like, I had tears in their eyes, like, oh my gosh, Lauren, like I'm so thankful. Like she's been eating all week. Like I don't think, and they're like, do you still think we have to have the G-tube? And I was like, well, at this point, no, I don't. And they were so grateful. And it's those moments where you're like, man, like, this is great. Like I really helped someone. Or, I had a little guy too that has a genetic micro deletion. And the first time he ate a puff in our room, his mom, she was like, where'd it go? And I was like, Mom, he ate it. And she was like, what? He ate it? And she's like looking at his mouth and, she's like, didn't you realize? I was like, yeah, he ate it. And she's like, just her face, she's like freaking out. And she's like, oh my God. And I was like, yeah, like he did it. So, just those little moments where like, the child did it. Like I didn't eat it for him, but just where you help someone achieve a skill that they maybe didn't think their child would do is great.
Those little moments are so big though.
Oh yeah. They're so big.
Moments. And then they just become so momentous. And then those kiddos reach those milestones. Yeah. Pretty exciting. That's why we do what we do.
Right. It's great and not just for our feeding kids, my speech and language kids too. Gosh, like the first time a kid, says a word or points is great.
Well, you gave us a lot of great advice today. Would you be willing to give us a list of your top resources and courses you would recommend for a student moving into, you mentioned some of them and we can put it in your show notes and put it as a download on the Fresh SLP website as well?
Yep, definitely.
I think we'd love to have that written out.
Yeah. So for people who are wanting to move into like infant feeding, babies coming out the NICU, I think that Karen Mitchell's course, what is it called? Like NICU and Transition Home or something to that effect. It's offered through CHOW. It's like CIAO. That I think is like the best introduction if you have no experience with this topic. And then Erin Ross has SOFFI, SOFFI. That's the Supporting Oral Feeding in Fragile Infants. That one I do think is better if you have a bit of background knowledge. It could be a little confusing if you're don't have some kind of experience. So I think if you do Karen's course first and then Dr. Ross's, that's a really nice segue. And then for our older kids, and by older I mean like 6 months and up, SOS. It's life-changing. I love it. So the intro, Kay Toomey is the creator of it, and I want to be.
What does SOS stand for?
Sequential Oral Sensory. And in case anyone doesn't know about it, it is not a swallowing program, so it's not for kids with dysphagia. It's a feeding program, and it's mostly for your sensory motor based kids. It does have a lot of sensory like sensory integration component. So a lot of it is helping the child manage their sensory system basically around food, because food for them, it's a physiologic stress response. There's been a lot of things in these kids' lives. They've learned that eating is stressful or painful or all of the above. So it's really helping the kids manage that. But the course is so great. The intro is 4 days. And then there's also, oh my gosh, I think like 10 or 12 advanced topic courses that you can take after. You have to take the introduction first. But they have advanced topic courses in G-tubes and transitioning off of your G-tube, autism, feeding kids with severe developmental disabilities, older kids like teenagers. So there's just a lot of advanced topics that you can do. They also offer a mentorship program that's, I think, 12 weeks. I did it a couple years ago, where it's like a weekly class that you need. It's Zoom or with Blackboard, but same idea. And so there's a lot of really great resources for that. That is probably the course that changed my personal practice so much. So I love SOS. And then I just finished, in August, gosh, it's almost been a year now. New York Medical College has an advanced certification in pediatric dysphagia. That is when I took it was online. I'm not sure. They're making some changes to it. But so that's like a college credit course. It's 3 semesters. And so that's, if someone who's interested in that, it's expensive. You have to go to New York for clinic. So if you don't live local, like I said, I live in New Orleans. So that got to be a lot. I had to fly to New York 4 times. I ended up not because COVID. But so that, if that's something you're interested in too, that I think could be a good one. And also if you have no experience, I think that it starts out on a pretty introductory level. So yeah. And then those are the main ones I've done. I'm trying to think if there's anything else. There's some very good courses free through Passing Mirror, because a lot of when you start having kids with trachs, and that really can impact their eating for a lot of plethora of reasons. So, and those are free. So go ahead and do those. Yeah.
All right. Excellent. Last question. We are working on word cloud here at Fresh SLP. So we're asking all of our guests to give us 1 or 2 words that you think describes an SLP.
Oh man, that's hard. All right, let me think. I think maybe adaptable. I think we've all had that experience where what you think is going to happen is not what actually does happen. So we're good for, adapting. You said 2 or 3?
1 or 2.
Okay.
Another one. Give me another one.
Oh yeah, let's think of another one. I think undervalued. And maybe not undervalued, but misunderstood perhaps. I think that our field a lot of times gets a rap for being easy. It's not. So and I think a lot of people, I'm sure we've all had this experience, or if you haven't, it's coming to you where they, they think you teach debate speech, or, oh, you just teach kids how to say R, which teaching kids how to say R is important. If you are the child or the parent of a child who can't say R, that is a really big deal to you. So don't say, I hate when they say, oh, that's not true. But we do a lot more than articulation. So I think we're as a profession pretty misunderstood in what we do and what we have to offer, and what our training is. A lot of people are shocked when I say, oh yeah, I remember my first year working my CF year, I had a teacher come to me and goes, oh, for your speech certification, was that a weekend course that you did?
Oh
yeah, I was pretty insulted. I had just graduated, so I was fresh, remembering grad school, and I was like, no, it is a master's degree. And she was really shocked,
Mm-hmm.
Yeah, a lot of people were like, wait, what? It's that hard? I'm like, yeah, it's an allied health profession. Yes, it requires real academic performance.
Yeah, we're the real deal.
Yeah, it's
a real deal, and advocating for ourselves and for our career and our profession, and all that we do is so important.
Right. Yeah, and constantly, and I feel especially in the school side, you get the speech teacher. I shut that down pretty quickly, but then I see a lot of things on social media and stuff that oh, it's pretentious to not want to be called speech teacher, and I'm like, no, it's not. It's not pretentious to want to be called your actual title. I mean, like, obviously I don't expect my little kids to say like a speech pathologist, but like, no, I introduce myself as a speech pathologist, and people kind of will like balk at that. I'm like, well, that's what I am. Like, the physical therapist says this physical therapist, and no one balks at that. So,
well, imagine standing in a radiology suite ready to do a modified barium swallow. And this is, the radiology team, we introduce ourselves as a team. I am Maddie, speech pathologist, and one of the members on this team. And this is what we're doing today. So it's using language that validates what we do.
Right.
And adds to our credibility.
Right, exactly. And it's not, you don't need to have your nose up in the air about it. It's not that you're better than that tech or the teacher or whoever, but just that's what you do.
Mm-hmm.
That's a piece of advice. Like, don't.
Yeah. All right. So adaptable and misunderstood.
Yeah.
Those are the two we're going to go with. All right.
I think so.
Well, thank you for your time today. This was great talking to you and learning about what you do as a pediatric speech pathologist in the medical setting.
Yes, thanks for having me.
I hope today's conversation has created some aha moments for you and motivated you to become a better SLP, continuing to connect some of those missing links between what you know and how to use that knowledge. Thank you for downloading the Missing Link for SLP's podcast. And if you enjoyed the show, I'd love you to subscribe, rate it, and leave a short review. Also, please share an episode with a friend. Together we can raise awareness and help more SLPs find and connect those missing links and get the information needed to help them feel confident in their patient care every step of the way. Follow me on Instagram and join the Fresh SLP community on Facebook. Show notes are always available, so come learn more at freshslp.com. Let's make those connections. You got this.